And Dr. Lisa Crossley is just joining the stage. She is CEO of Reliq Health, trading under the symbol RHT on the venture. I am just loading up her presentation right now, and Lisa will jump right into it.
Great, thank you.
Thanks
for having me, Neil and Bruce. So my name's Lisa Crossley. I'm the CEO at Reliq Health Technologies. Can I advance my own slides, Neil, or do you have to do that for me?
You can advance the slides by just hitting the right icon there, putting your mouse over.
Yep, got it. Thanks. Sorry about that. I won't read the forward-looking statement disclaimer. I'll leave you all to read that at your leisure. So who are we? Reliq Health Technologies. We're a global telehealth company, and we are focused on delivering virtual care software as a solution, software as a service solutions to the $100 billion market in the US. That's for virtual care and specifically around chronic disease management. Our platform was designed specifically to benefit all of the constituents in the healthcare system, so not just patients and clinicians, but also payers. And we have a suite of services as well as our software solution that allow clinicians to seamlessly roll out quite a broad variety of new virtual care services to their patients. And these are billable services for the clinicians, so new sources of revenue for them. Ourselves, we generate recurring revenue from subscriptions, and we are paid by the clients who are the clinicians. We are currently experiencing rapid organic growth, and we expect that to continue for at least the next 3 to 5 years, driven by industry trends as well as our own work over the last few years in really building our reputation and business in the space. By the end of this year, we will have achieved very strong margins. Our target gross margins are 75% and EBITDA margins are 45%. And we should be there by the end of December of this calendar year. And we expect to at least double revenues year over year for the next 3 years. And to give you a little insight into how that's going, and all of the growth for our company this year has really come in the second half of the year. And we more than doubled, I think almost tripled revenue in the quarter ending September 30th versus the quarter ending June 30th. So we're well on our way. So recent milestones, at the end of June, we hit a revenue run rate that equates to profitability. So this past quarter that ended September 30th was our first full profitable quarter. We expanded across the continental US as well as into Puerto Rico and the US Virgin Islands. And we've signed contracts with clients who have hundreds of thousands of patients, but we have not just contracts, but what we call implementation plans, where clients have given us a specific staged rollout with dates and patient numbers. And we have plans that run through to the middle of 2023. So we know that by mid-2023 calendar, we'll have at least 200,000 patients onboarded onto the platform. And that's just with existing business, existing contracts. And that equates to about 100 million in annual revenue. So the business is definitely in a very significant growth phase right now. We don't expect to need to raise capital in order to achieve our target milestones. We expect by the end of this year to be doing a revenue run rate of about 2 million a month or 24 million annually. So we will be able to fund operations, including any expansion that's necessary from proceeds of sales. And we are looking at a NASDAQ uplisting for later in 2022. I think that's the right listing for us, as a senior exchange, but also as a US technology-focused exchange, because certainly 99% or more of our business is in the US. So I won't, again, read this very detailed slide to you line by line, but the one thing I do want to call out is that we're currently trading somewhere around $1.15, $1.14 Canadian today. That gives us a market cap of a little under 200 million Canadian. Typical multiples in this space are anywhere from 5 to 25 or 30 times revenues. And certainly the valuations are typically tied to growth, profitability, and profit margins. And so, across those three parameters, we score very high. So, we're rapidly growing, very rapidly growing, and we have very good profit margins, and we are now profitable. So I would expect that over time, as more of our quarterly results come out and the market becomes more familiar with us, we will command multiples on the higher end, sort of over 25x. If you look at Livongo, which was acquired by Teladoc a few years back, and they're in an adjacent sector. They had a 40x multiple on revenue at the time that they were acquired. So they were acquired for around 79 billion, I think it was. And at the time, it was 40 times revenues, but they were operating at a loss. So, there's definitely very compelling multiples to be had in this space. Again, I won't read all the details of this tiny little font, but I'll just say, for myself, this is the fourth company that I've run as CEO. The first three were privately held, although my first experience in industry was at a publicly traded company in Boston. And we had a very successful IPO and then ultimately went private again through an acquisition by Shire Pharmaceuticals for $6 billion. And I sold my first privately held company that I ran to company out of Massachusetts called Millipore Corporation, which is a multi-billion-dollar multinational that was then acquired by Merck. The rest of my team, they're very strong, not just in their sort of specific areas, but all of these people have experience in bringing new technology products to market and in launching and building successful commercial ventures. So I think we're very well positioned as we move forward into this extremely rapid growth phase. So the context for our business, why are we doing this? And we're really trying to address the issues around the fact that 20% of the population in general in the developed nations have chronic diseases like kidney disease, chronic obstructive pulmonary disease, congestive heart failure, high blood pressure, diabetes. But that 20% of the population accounts for roughly 70 to 80% of all healthcare spending. And the reason there's such a dramatic disconnect is that these patients tend to be hospitalized very frequently. So because they are complex clinical conditions that they're coping with when they go into the hospital, it's typically an intensive care unit admission. So they're there for several weeks and it's hundreds of thousands of dollars to the healthcare system. And the reason that these patients are hospitalized so frequently is that, left to their own devices at home, they're supposed to manage their own complex clinical conditions, to take their vital signs, take their medications, and remember to act on any early warning signs. We know that less than 50% of this population takes their medications as prescribed. They're just not able to remember or coordinate. And we're talking about patients who typically are sort of 70 and over and have multiple very significant clinical conditions. So it's a lot to ask them to manage them on their own in the home without any support. And so a few years back, Medicare and Medicaid recognized that this was a significant issue, and as the population ages and grows, it was only going to become more costly. And so they switched from a typical fee-for-service compensation model, where the more often a physician saw a patient, the more money they would make, to more of a value-based compensation model, where physicians are actually held accountable for health outcomes in their patients. And that's been very positive, I think, from a healthcare system perspective, but also certainly has really driven adoption of our technology. And we're targeting a huge total addressable market. It's 37 million Medicare and Medicaid patients who qualify for this kind of virtual care. And that number is growing every day as Medicare and Medicaid expand their programs. So this is a little pale, I apologize for that, but we have a suite of software solutions. So our overall platform is called iUGO Care, but it's modular and it includes things like remote patient monitoring, classic telemedicine or virtual visits, behavioral health integration, which is care coordination for mental health and addiction patients, and principal care management, which is for specialists as opposed to primary care physicians. But the really sort of important thing about this slide is to know that we have a very comprehensive platform that's very flexible. So we're able to respond very quickly when Medicare and Medicaid introduce new billing codes. And as a result, we offer something that nobody else in the space offers, where our clinicians can monitor patients with anything from, dementia or a risk of falls or cancer through to the typical chronic diseases that we discussed earlier in the presentation, rather. So it's a very powerful platform that really lets clinicians leverage all of the new billing codes as Medicare and Medicaid introduce them. Just to give you an example of the use case and to kind of understand how it's better if you're using iUGO Care. So typically a chronic disease patient will be on their own at home, responsible for taking their medication, for checking their vital signs. In this case, we have a congestive heart failure patient, and typically there will be these exacerbations or episodes of fluid load or fluid increase. So the patient is supposed to weigh herself every day, write down what her weight was, check it against the previous day's log, and notice if there's a sudden increase of, say, 2 pounds in about 24 hours. And if there is, the patient's supposed to call their physician. But typically what happens is the patient either doesn't remember to check their weight on a daily basis, doesn't write it down, doesn't remember when she was supposed to call the physician. And so the fluid continues to build up in the patient's system. It puts pressure on the heart and the lungs, and you can end up actually with permanent damage to the heart or the lungs or even some of the additional organs, key organs like the kidneys. And so eventually the patient will get to a point where she's feeling pain or pressure in the chest or having difficulty. She'll go into the hospital, and at that point she's looking at an admission to the intensive care unit, and that's going to cost the healthcare system hundreds of thousands of dollars. If, by contrast, she was using a Yugo Care, she would receive audible daily reminders from our system in whatever language she speaks, reminding her that she needs to step on the scale. As soon as she does step on the scale, we would collect the data over either the internet via Bluetooth or over the cellular network. A lot of our patients are using devices that have SIM cards installed and are cellular enabled, so that we can collect data even from patients in very remote and rural environments. And a lot of people over the age of 70 don't have internet in their homes, whether by choice or because of constraints in their environment. So it's really important that we're able to connect to these cellular devices. And so her physician will receive an alert, this patient has gained 2 pounds in 24 hours. They will call in a change to her diuretic medication, and that patient can stay healthy and at home indefinitely. So tiny little interventions, early stage interventions in the have a really dramatic impact on not just health outcomes, but certainly on healthcare spending. So the benefits of our platform for patients, obviously, if you have better health outcomes, fewer hospitalizations, you're going to have a much better quality of life. And that translates to their family and informal caregivers as well. For clinicians, Medicare and Medicaid introduced penalties a few years back whose patients are hospitalized. They're really trying to keep these preventable complications from happening and from resulting in hospitalization. So there are actual financial penalties where Medicare and Medicaid will claw back some of what they're paying physicians if their patient population is going into the hospital. In addition, Medicare and Medicaid have dramatically increased reimbursement for virtual care services. So when we started in late 2017, 2018, working with patients, there was only one billing code that Medicare had just introduced for remote patient monitoring. It was generating about $59 per patient per month for clinicians. And now our typical clinicians are making over $372 US per patient per month. So the typical practice is generating over $1 million in new revenue by deploying our platform. And we're only charging $40 to $100 per patient per month, 40 if it's just the software, 100 if it's the software plus our care management services. So these are very, very high profit margin new revenue streams for clinicians. And as the reimbursement levels have increased, we've certainly seen tremendous market pull for our solutions where, when we get one clinician onto the platform, we 2 months later after they've had their first two payments from Medicare and Medicaid, we get calls from 6 of their friends in the community saying, sign me up, how can I get on? And can you do it quickly? And so our revenue model and opportunity, as I say, our core focus is at 37 million Medicare and Medicaid patients with 2 or more chronic diseases. But Medicare has significantly expanded the billing code. So there's now compensation for behavioral health integration for mental health or addiction patients. And they've included a bunch of new conditions, so high-risk pregnancy, musculoskeletal issues, asthma. So our target patient population is actually probably almost doubled really over the last 18 months. We charge subscription fees to the clinician of $40 to $100 per patient per month. We receive our payments from the clinicians, but we actually do the electronic claims submission on their behalf to Medicare and Medicaid. And we also do electronic pre-authorizations for all of their patients. So when they give us a patient list and say, we want to put these patients on your platform, we run those through the Medicare and Medicaid databases and ensure that all of those patients are eligible. We secure pre-authorizations from Medicare and Medicaid, so our clinicians know 100% certain that they will get paid for those patients, and then we follow up at the end of the process with the electronic claim submission. Excuse me. So our growth By the end of this year, as I say, I think we'll hit a revenue run rate of about $2 million per month. Next year, we expect very significant continued growth. We've sort of conservatively said 32 million in revenue for next year, but we're going to be upgrading or updating our guidance probably at the end of November when we issue the quarterlies for the quarter ending September 30th. Certainly if you just look at the progress we've made this year, we'll go from about 2,000 patients on the platform at the beginning of April to we should have over 40,000 by the end of December. So we are growing quite quickly. And if you just kind of extend that curve, you can see that the growth forecasts are pretty conservative. We are looking at a NASDAQ listing next year, as I say, and we will have hit our target gross margins of 75%, EBITDA margins of 45% at that point. And the following year is really when our big data play comes online. So we keep a copy of all of the data that we handle, we anonymize and de-identify it, and that data can be licensed to pharmaceutical companies, governments, research institutions, and that I think will be one of the company's greatest assets as we move into 2023 and beyond. And so finally, just a little bit about the trends and the tailwinds that have gotten us to the point where we are really at a kind of explosive growth phase. And one is that the population is aging and growing, and that's a huge issue for Medicare and Medicaid, who have a very tight budget, and that's only going to get tighter as more and more people are subscribing and hitting that age of 65. And as the population ages and grows, there's not only more chronic disease patients because you have more older patients, but because we have a more technology-focused lifestyle now, less manual labor, the percentage of the population that has chronic diseases is increasing. So there's going to continue to be that strain on the system, and that's going to continue to drive adoption of any solution that'll keep those chronic disease patients stable and out of hospital. As I mentioned, Medicare and Medicaid have introduced financial penalties for clinicians. So there's a very significant stick on the part of Medicare and Medicaid to encourage clinicians to adopt virtual care proactive solutions. And there's also a very significant carrot. And as I mentioned earlier, the reimbursement levels for virtual care have increased by over 500% since we started in this market in late 2017, early 2018. And the number of billing codes have increased from 1 to 18. And we know that Medicare and Medicaid have already announced that in 2022, they'll be adding a further 5 billing codes and increasing the amount of the reimbursements for the existing billing codes. So certainly all of the trends in the industry suggest that it's going to be continued growth going forward. And the reason for that growth is that Medicare and Medicaid have documented over the last 3 years that implementing proactive preventative virtual care programs like ours really does keep patients out of hospitals. So your average cost of care for a patient goes from hundreds of thousands of dollars to under $4,000 or $5,000. It's a very dramatic cost savings. And as a result, the expectation is that these kinds of virtual care programs will save Medicare and Medicaid tens of billions of dollars every year going forward, which is really going to make Medicare and Medicaid sustainable for the long run. So that's our quick overview. Thank you very much. And I hope you'll all get involved in the Reliq story. We think it's a very exciting moment in time for the company.
Thank you, Lisa. That was an incredible presentation.